Do you have back pain and pelvic pain? Maybe they can be connected. Maybe one has something to do with the other. Let's talk about it. Here are 3 ways that your pelvis and your back are connected, and pelvic pain or pelvic positioning can affect back pain. Number 1, posture and alignment. So if you are standing a certain way, there's something called sway back posture. Or if you're just not aligned, your rib cage should be like right over your pelvis, right? If you don't have this really neutral posture, it can lead to muscle imbalances, pelvic floor dysfunction, and back pain. It can be putting a lot of stress on the ligaments in your low back, the muscles in your low back, and the muscles in your pelvis. So making sure that you're standing with your posture properly aligned, and this affects the pressure also, going from your abdomen down into your pelvis. That's a whole other story. But making sure that you have good postural alignment is important for good pelvic floor functioning and a healthy back. Number 2, you can have referred pain. So sometimes people feel pain in their hips and their pelvis and their back, and they can't really pinpoint where it's coming from, right? So it could be from, different postural issues and alignment issues. You can have pain coming from a nerve in your back that can be radiating into your pelvis. You can have different issues like in the back of your pelvis that radiate to the front, because if a nerve is irritated in one part, you may feel issues in other parts of where the nerve innervates. So the signals are traveling along the nerves, and nerves are splitting along the way, and you can have issues and feeling weird neural symptoms in different parts of your body, but it's coming from somewhere else. So it could be starting from the back, and you could feel it in the pelvis. So it's all connected. The pelvic floor, the pelvic muscles in the base of your pelvis, it's all part of your core. When we think about core, we think about the abdomen, right? And we think about 6-pack abs. And really, the core is a whole system. It's a whole pistoning system. If you had to think about it like a cylinder, right? There's the abdominals, you've got the muscles in the back, and you've got your diaphragm on the top and your pelvic floor on the bottom. So it's connected. Pelvic floor is your stable base that you need for a strong core. You can't ignore it. You can't just do ab work and have a strong core. You have to have a stable base. So you need a strong pelvic floor. So it's all connected. So if you're having trouble finding your pelvic floor or trying to figure out where that pain is coming from in your pelvis or in your back, or you want to work on posture and alignment, reach out to a pelvic floor physical therapist. We can help you. We can teach you exercises. We can recommend different devices to use and help you get back to feeling healthy and strong. Follow for more.